Medical marijuana has come to Massachusetts, and hundreds of patients holding medical marijuana cards are being served in dispensaries throughout the state, including one right here in our region. The brand new New England Treatment Access Medical Marijuana Dispensary Center in Northampton opened on September 28th, and Monte Belmonte took a tour to find out more in this month's Life with Monte segment.
New England Treatment Access. It's the medical marijuana shop on Conn Street in Northampton. Medical marijuana has been legal in the Commonwealth of Massachusetts since 2012. And joining me is Leslie Laurie, and now you're here at the helm of the only game in town when it comes to medical marijuana, New England Treatment Access. How hard is it to become a medical marijuana patient?
It isn't really hard, but there are a number of steps to be able to become a patient. And one needs to go to a certifying doctor, get certified, and doctors in Massachusetts, unlike other states, are able to determine what the condition is that would work for medical marijuana.
What are some of the reasons that people would prescribe medical marijuana?
Well, what we've seen in the few weeks that we've been open, and
Right.
it is really exciting to have the doors open now in Northampton finally after these 2 years. But people are coming for issues related to pain, issues related, someone is having cancer treatments, and this is a really good way of helping with issues related to nausea or eating or sleeping. We have lotions that work for psoriasis. And
So it's not all just smoking, as many people think.
yeah, not at all. And I hope as you make your tour, what you'll do is to see the many different products we have. And what is so interesting is that the average age of our patients is 47, that over 1/4 of our patients are over the age of 60, and we actually have 2 patients that are over the age of 90.
Wow. And
And-
are they people that were using marijuana before it was legal, or are they people who are now just saying, I need an alternative to what other medicines have provided?
And I would say it's a combination of both. There are some who are so happy that they don't have to meet someone in a dark parking lot
Right.
to be able to get medication that they know is helpful. So what this place really affords people is the ability to try different strains to be able to see what will work the best for them.
Well, let's go through the process of what it's like to come into New England Treatment Access, walk you through the steps and look at some of the products. We're going to meet Norton outside the door and go through the security procedures and go check out the bud tenders at the bar down there.
So this is the first security checkpoint right here. This is assuming that you already are a patient. You've signed up with the Department of Public Health. You receive your ID. It looks very much like a driver's license. And you're actually going to show that medical marijuana card into the camera. The security specialist on the inside is going to verify that you're a patient, and you're going to be buzzed into the building.
All right, so we're in. You can't open one door in until the other door shuts. It's kind of like, almost like airport security, but you can leave your shoes on. But what's the next step?
So we affectionately call this area the man trap. And ultimately, this is a security vestibule where your documents get checked against the state database. So you will give Cameo here, our security specialist, you will give him your driver's license or your government issued identification and your Department of Public Health medical marijuana registry card. He pulls you up in the system, he sees that your information is valid, and then you are already in our system. Then you would be buzzed into the floor of New England Treatment Access, the dispensary itself.
Let's go to the floor. All right, so this looks familiar from another life. This is what I think of when I think of marijuana, and these are buds, just the plants that people would smoke in a pipe. And some of the names, like Face Wreck, that doesn't strike me as medicinal, but where do the names come from?
Well, the names themselves, just like there are, Cabernet Sauvignon or Merlot or types of grapes of wine,
Right.
It tells the patient, the consumer, the sort of vintage. It tells it where it's from. It's a transition point between the illegal market, where we were until 2012, and now. And so I expect over time these names are going to change. They're going to become more indicative of the medicinal qualities of it. But for somebody that walks in, all their life they've known this product
They've called it ChemDog their whole life.
by its pseudonym,
Right.
and so now
They wanna know what
it's
they're
a
getting.
point of reference.
And it's interesting because we are in an opioid crisis in this area, and a lot of that stems from legal prescriptions of opioids that then people are turning to street drugs like heroin and dying. Is this an alternative to some of those same things that could be prescribed as opiates from doctors? And Is there a danger associated with any of these products in the same way there's a danger with opioids?
Monte, that's a great point. This is an epidemic. It's nothing short of an epidemic. Governor Baker has, recently spoken to this, and in fact has made the link between opiate abuse and the potential substitution by less harmful medical marijuana. And that certainly is something which I think, is one of the unexpected consequences of regulating medical marijuana. In fact, the Journal of the American Medical Association just last year issued a report saying that in states that have legal medical marijuana, opiate overdoses have fallen by 25%.
Now, it's very likely that in 2016 on the ballot will be a question about full legalization of marijuana. What does that mean for a place like NETA?
Well, we've seen in other jurisdictions in Washington State and Colorado that the two systems of medical marijuana and adult use marijuana can coexist. They aren't mutually exclusive. First of all, this is a medicine and it isn't taxed. Recreational marijuana, adult use marijuana is going to be taxed up to 15%.
Right.
The type of strains, the actual type of genetics that one grows for a medical marijuana patient are different than you would grow for a recreational patient. Certainly, I think, this shows that responsible regulation can work, that a city can regulate this in a safe manner for public safety, that the sky doesn't fall, that people still go to church on Sundays, that schools open, and so I definitely think there are some lessons to be learned.